Tinnitus can be incredibly frustrating, an unwanted sound you didn't ask for, that you can't turn off, and that can quickly take over your life. It affects your sleep, your focus, your mood, your ability to relax, and before long you're caught in a cycle of overthinking, anxiety, and stress that only makes the ringing feel worse. If you've been stuck in that loop, here's something you may have heard. Try to talk to a therapist. And maybe your first thought was, what? How would a mental health approach help someone? I'm clearly just hearing a noise in my ears. Isn't it something physical with the ear's structure or my eardrum? Well, here's the truth. Tinnitus is in the brain. It's linked to the auditory system as well as a psychological system. It's not that you're just imagining this or this is created because of a psychological problem. It's that reducing anxiety about the sound is one of the most important steps in reducing the sound itself. In this video, I'm going to explain exactly why that is and how calming your emotional response can start to reduce tinnitus itself. The medical field recommends psychological intervention as one of the most effective treatments for tinnitus. Not because tinnitus is all in your head, but because the way we react to tinnitus, both mentally and physically, can be the key to breaking the cycle. Psychological support, especially cognitive behavioral therapy, is a highly effective strategy for tinnitus relief and releasing fear, regaining emotional control that can completely change your experience of living with tinnitus. I'm Dr. Ben Thompson, audiologist and founder of Treble Health. We're a nationwide private practice that specializes in tinnitus. My team and I have helped thousands of patients reduce tinnitus and associated anxiety. Every day we have appointments with dozens of patients undergoing treatment, and I want to now explain how you can stop anxiety and make your tinnitus better. Let's dive in. First, you need to know that tinnitus is the sound you hear. Anxiety is the emotional response or reaction to that sound. When someone develops bothersome tinnitus, the problem isn't always just the volume of the ringing. It's how the brain and body react to it. For some people, tinnitus stays in the background and it's a mild condition. It doesn't affect their day-to-day life. But for others, it becomes more intrusive, louder, emotionally distressing, and almost impossible to ignore. That's when tinnitus really becomes a problem. Not because it's damaging the ears, but because it's triggering a cycle of fear, anxiety, and stress. Now, this happens because our brain, specifically the limbic system, is constantly assessing whether something is a threat. If the brain interprets tinnitus as threatening or mysterious or unknown or unwanted, it activates the amygdala to protect you and be alert to potential dangers in your environment. The amygdala is the part of the brain that controls fear, and that fear can really set off what's called the fight or flight response. This is when the body tightens, breathing gets shallow, your heart rate can go up, muscles, especially in the jaw and the shoulders and the neck, get tense. And the ringing, it doesn't go away. It feels louder and more intrusive. Anxiety isn't just in your head. It's also in your body, in your nervous system. We're tight, our breathing is shallow. These are all things I know you guys are going through. When we're anxious about tinnitus, we're not just thinking about the sound. It's our entire nervous system that's on edge. Shoulders being clenched and high and tight and breathing being shallow is one of the most common things that I see. Now, the whole body can put itself in a sort of defense mode, responding to a sound as if there's a physical danger or potential threat in the environment. But tinnitus isn't actually a physical danger. The sound does not harm you directly. It can't injure you. But when your brain treats it as a threat, your body responds as if it is one. That's why the stress response makes tinnitus worse, and that's why we can't just treat tinnitus with pills or procedures. We have to treat the system that's reacting to it. Anxiety is usually future focused. It's rooted in what if thinking. What if my tinnitus never goes away? What if it gets louder? What if I can't sleep? Those thoughts are normal, guys. They're a response to fear, but left unchecked, they can create catastrophic thinking, a mental spiral where worst case scenarios feel like inevitable outcomes. This is why the emotional brain, especially the amygdala, plays such a big role in suffering with tinnitus. The amygdala is there to protect you, but in this case, it's reacting to a sound that's not a real danger, and that constant sense of alarm keeps the tinnitus front and center in your head. Here's where another mental trap we see often can come into play: all or nothing thinking. It sounds like this: the only way I'll feel better is if tinnitus is completely gone. If I can't cure this, I'll never enjoy my life again. These thoughts are not helping you. They lead to hopelessness, frustration, and overwhelm. And here's the truth: silence is not the only acceptable outcome. Plenty of people live happy, full lives with low-level tinnitus, a mild tinnitus, including myself for the last 10 years. If I'm in a quiet enough place, I hear a high-pitched hissing in my head. A vast majority of our patients at Treble Health who are going through significant tinnitus get better, and they experience positive, significant improvement. 30%, 40%, or even 80% reduction in the volume and the reactivity to tinnitus is available. And that kind of improvement is life-changing for our patients. So don't let the idea of an all or nothing outcome prevent you from pursuing progress and getting relief. One of the most powerful shifts that I see in our patients is when they realize that tinnitus itself is not the problem. It's the way the brain is reacting to the sound. Let me tell you about a patient I worked with. This gentleman had severe tinnitus and was stuck in fear. He spent months trying to fix it, chasing down the root cause with multiple doctors, changing his diet, traveling to specialists, spending thousands of dollars on alternative therapies like acupuncture or Eastern medicine. But it didn't help. The more he chased the cause, the more anxious and defeated he felt. His tinnitus wasn't getting better, and in fact, he was thinking that it was even getting worse, and it was louder than it was at the beginning. The turning point for him came when he let go of the need to fix his tinnitus and instead started working on cognitive behavioral therapy or CBT techniques. He trained his thoughts, he relaxed his body, he focused on sleep, and his brain started to follow his lead, and it learned that this is not a threat. Once that happened, things started to slowly, progressively change for the better. That was the moment that he started to get relief. This is why the medical field recommends psychological therapies like CBT as one of the most effective treatments for tinnitus distress. CBT doesn't remove the sound, but it changes your response and reaction to it. It teaches you how to challenge catastrophic thoughts. CBT helps you recognize fear-based thinking. It gives you tools to reduce anxiety in your body. And over time, it retrains the brain to put tinnitus in the background where it belongs. And this is how you break the tinnitus, anxiety, fear cycle. Not by trying to cover the sound completely or avoiding it, not by silencing the brain with medications that don't help, but by shifting the way you relate to the sound and the emotions around it. I asked my team of tinnitus experts at Treble Health, what are the most effective techniques to help your patients reduce anxiety caused by tinnitus? And here's what they recommended. First, STOP, a mindfulness-based acronym that helps you interrupt distressing thoughts and regain control by pausing, observing, and responding mindfully. Second, 5, 4, 3, 2, 1, a grounding exercise that brings you into the present moment by using your 5 senses to reduce anxiety and recenter. Third, a cognitive distortions worksheet, a handout we give to patients that helps identify and reframe unhelpful thinking patterns like catastrophizing or all or nothing thinking. These tools are simple, powerful, and often become daily anchors for our patients during their tinnitus treatment. If you'd like to speak with a specialist from Treble Health, you can schedule a consultation today using the link right there on the screen or find it in the description below. For our patients, we use a 3-pillar system to help recover and get relief. The first pillar is changing the brain's reaction to the sound. We help you reframe your thoughts, reduce fear, and calm the emotional response. The second pillar is using sound to help retrain the brain and reduce tinnitus. We build a customized sound therapy plan that includes hearing aids, sound generators, and a Bluetooth sleep headband. You can see right here, this is an example of what sound therapy devices or hearing aids look like for tinnitus. They sit up and behind the ear. You can see right now on the screen, I'm going to put this device in my left ear. If you'd like access to any of these sound therapy devices, reach out to our team at Treble Health for a free consultation. Here's a sound machine which comes with about 20 inboard sounds that patients can use in their bedroom, on their bedside table, in their living room, or in their home office. And finally, this is our sleep headband. You can see right here, it has some thin speakers alongside the headband right here. It's in this area, as well as this area. These would be worn over your ears, and then you put this part on your forehead, and you can stream this via Bluetooth so that you get sound therapy in your ears. So the sleep headband relies on Bluetooth. The sound machine has sounds inside of it and can do Bluetooth. Hearing devices as well, the sound therapy devices or hearing aids, they have inboard sound therapy and they can use Bluetooth as well. The third pillar is to calm the central nervous system. We teach you how to relax the body through breathing, movement, sleep, and mindfulness practices to shift out of the fight or flight and into a state of calm. When you work all 3 of these together, that's when you start to see real sustainable progress. And that's not only with tinnitus, but also any underlying stress or anxiety that may have been there before the sound even began. So if you're stuck in a fear, stress, or catastrophic thinking state about your tinnitus, please know that many of our own patients have been there before. You're not broken. Tinnitus is not set in stone. It's a neurological condition and you can get better. The problem isn't just the sound, it's the system around it. It's the brain's reaction. And that reaction and response can be changed. You can learn to stop reacting. Your brain can change at a subconscious level to retrain itself. And once you do that, you can feel like yourself again. If you are listening to this and you feel like you could use professional help with your tinnitus, I invite you to schedule a free consultation with my team at Treble Health. We've helped thousands of patients take back control over their life, and we can help you too. You can click the link on the screen right now to book your free call today, where one of our professionals will be available to guide you through the next steps. There is help out there, and please use my team at Treble Health. Also, if you'd like to check out the next video, you can hear 3 tinnitus success stories of other patients who reduced their tinnitus. It's a perfect follow-up to this conversation, and I think it will really help you move forward. Thanks for watching this video, and I'll see you soon.